So, good evening, all who has joined this session on infectious diseases, the scope and the future. So, I am Dr. Mohammed Niaz. So, I am an infectious disease consultant as well as an infectious disease faculty at Doc Tutorials. So, infectious diseases, what is the scope? Now, many of you have heard about infectious diseases as a specialization of medicine. It is relatively new to India, has been introduced to India as a subspecialty of internal medicine only a few years back. Now, what is the scope? Like, is this branch has a scope? Like, we have various branches like cardiology, nephrology, rheumatology, endocrinology. Does this particular branch has any scope? Is one question that will be in all your mind. I'm going to answer the question: the scope of infectious diseases, the future of infectious diseases, as well as how to choose a seat for infectious diseases in India. Now, infectious diseases, the scope is not something that is small now. Now, we all know after COVID, ID has come up as a major branch of internal medicine, but ID is not alone COVID. There's a lot of things to do in ID. Now, you know that the antibiotic resistance is something that is coming up in a big way. We have most of the drugs that are encountering in hospitals are resistant to most of the drugs, and antibiotics is no longer everyone's game. There was a period in which antibiotic could be prescribed by anybody, any doctor, but now the resistance pattern of the drug has become so much difficult to treat that you need a specialist to treat difficult to treat. It's not that every infection need an infectious diseases, but many of the infection which are drug resistant definitely need an infectious disease consultation, and many of the hospitals and therefore in lookout for an ID specialist. Now the second thing is that increasing antimicrobial resistance, everybody wants to preserve the antibiotics, and to preserve the antibiotics every hospital should have a robust antimicrobial stewardship program, which is also recommended by various quality control organizations as well. So antibiotic stewardship, definitely infectious diseases physician has a major role to play. Now, lots of transplant is happening in the country. Unlike previously, the number of liver transplant, heart transplant, lung transplant are increasing. And transplant infection are something again which require a specialist to address. Now, HIV and tuberculosis, which was always there for ID, now the HIV patients, again, the number may be decreasing, but there are still number of cases of HIV. Now, regarding tuberculosis, we know that there is a significant number of multi-drug resistant tuberculosis in the country. Those also which require some of which, like mostly drug resistance one at least, requires the treatment by a specialist. Then you have other branches like ID specialists are also involved in adult immunization, involved in travel clinic, like the travel requires many vaccination, travel advices like what are the infectious diseases. People go to exotic locations now. So they will be asking you what precautions I take, or like what should I take, or what prophylaxis I take, malaria prophylaxis, other prophylaxis, leptospirosis prophylaxis, and what travel vaccination. And this is coming up in a big way. Infection control, every hospital is focusing on infection control to reduce hospital-acquired infections like ventilator-associated pneumonia as well as catheter-related bloodstream infectious diseases. Physicians, ID physicians play an important role. And public health. Now we know that various outbreaks are happening in the community, and various organizations like the WHO, other international organizations as well as national organizations requires people with expertise in infectious diseases as well as epidemiology. So these are all the scope of this particular branch. It's not something very small as it was before. This is a growing branch, something new to India, but definitely improving in its scope. But do you have the aptitude is the question. Now, the first thing is that it's a purely clinical branch. Infectious diseases is a clinical branch. It's not a laboratory branch of medicine. And if you love internal medicine, you are going to love infectious diseases. Because as infectious diseases physicians, you will be seeing all the variety of cases, infections in all the departments. So be infections in transplant patient, post-surgical infections, you will have a lot of infection related to surgeries. There will be infections occurring after transplant patients. All the other departments will be sending you consultations for infections in various part of the body, gynecology, pediatrics, orthopedics, a lot of bone and joint infections, septic arthritis. So you will be somebody who will be practicing medicine as a whole. You will be seeing all kind of patients, interacting with all the doctors in the hospital, and then you should love the bugs too. Internal medicine definitely, but you should have some likening, some interest say, in microbiology. That whenever you're learning microbiology, you should have this aptitude. What is this particular organism is? How can I treat it? So if you have an aptitude in internal medicine as well as you have interest or a likening towards the bugs, the bacteria, the virus, the fungi, and the parasites, ID is for you, and it's such an interesting branch. So, what do we learn in infectious diseases? What do we learn in our DM program or the fellowship program of infectious diseases? Basically, we learn the first thing is clinical diagnosis and management of infectious diseases, and you have to have a clinical acumen to diagnose as well as treat infectious diseases. So your internal medicine should be strong, physical examination should be strong. Also, you should learn in addition a specific diagnostic test, interpretation of them, as well as a treatment using higher end antibiotics, reserve antibiotics, which usually other physicians may not be using. You should also be well adapted with the procedures of internal medicine. Like we may require a lumbar puncture, a pleural tap, brachydiocentesis, ascitic fluid tap. So all these kind of procedures you should be well versed in. This is because something infectious diseases course in some hospitals can also be joined by MD microbiology students. But in that case, you may have to put a bit of effort, higher effort, so that you can learn these procedures as well. Then we have ID clinics, which involve general ID clinics. You have travel clinics where people come for travel advices and immunization. Then you have adult immunization clinic. We all know, like this is an area which is neglected in our country. So because we have lots of vaccines which can be used in adults, which can significantly improve the quality of life, decreasing the risk of infection in adults. Then you have HIV medicine, ever interesting, all the time interesting. HIV medicine is not a small thing. HIV comes with all the opportunistic infection it has, and if you learn HIV, it said that you have learned medicine because it can present various systems can be involved, all the opportunistic infections. And then you have tuberculosis clinic, especially MDR tuberculosis is something that we should be focusing as in ID residents, MDR tuberculosis and XDR tuberculosis, as well as the drug sensitive tuberculosis. So all these things ID fellows learn. We also had antibiotic stewardship ground, so you see the higher antibiotics. Okay, there are various methods by which antibiotic stewardship can be done. One of which is prospective audit and feedback. You look at the antibiotic which is prescribed by physicians, and then you give prospective feedback in a friendly way. You tell them whether the antibiotic is appropriate or not, by which you can cut down the antibiotics. So that is one thing that ID fellows learn to. And hospital infection control is very, very important. You learn how to audit infection control, how to do various surveillance of various infection control aspect, and what are the various care bundles, how to implement it. So infection control is becomes something that ID fellows learn. And then you have laboratory. Definitely lab part is important because it's not general internal medicine alone, but significantly you should know the basic techniques that is used in clinical microbiology, which includes maybe as simple as a gram stain, AFB staining, stool examination. Everything is you are taught to do that. You are taught how to read a culture plate. You are taught how to interpret antibiogram. Okay, then you are taught how to interpret various molecular tests like PCR, as well as molecular tests in the tuberculosis like a gene expert, as well as a line probe assay. So all this kind of basic microbiology and some advanced microbiology, you definitely will have some posting in microbiology. It depends upon the institute where you are learning at least 6 months of microbiology posting you'll have, where you should have a good acumen, and your exams also will be, you will be having to do some of the procedures in clinical microbiology, at least the basic procedures in microbiology, but you should be able to interpret microbiology results as good as a microbiologist does. Okay, that is something that will be expected as out of ID fellows. Now, one important question that everybody asks us is whether microbiology students can also do good as ID physicians. Now, the answer is simple. Like, I have many microbiology friends who has been my colleagues or my superiors. Many of them are doing extremely good. Okay, so it depends. It depends on aptitude. You would have chosen microbiology for your MD period, but if you have the aptitude in clinical medicine, that is very, very important. If you are sure that you can shine in clinical medicine, you have the aptitude in clinical medicine, to elicit history and physical examination and to do procedures in internal medicine, you definitely can join the program. And maybe you will have to put extra effort in the, at least in the first 1 year. You will have to bring back your medicine or learn internal medicine, the procedures in that. But if you are putting your 100%, definitely you can be a good infectious diseases physician. Some of the institutes in India, they allow microbiology MD to join infectious diseases program. So it depends upon your aptitude again. So many of my friends who are MD microbiology and done infectious diseases TM from AIMS New Delhi are doing quite good. So definitely microbiology can also join, but your effort matters. You will have to put some extra effort definitely. So DM infectious diseases courses in India are currently in few institutes. AIMS New Delhi was the first to start in the AIMS group. So if you have an MD or DNB in medicine, pediatrics, microbiology, or tropical medicine by NMC recognized university, that is the qualification for you to write the DM infectious diseases entrance examination. Now, this is the seat metrics which was shown in the current prospectus of the INISS. So, as of this year, they are admitting students only, it seems to be only to the Delhi AIMS, 3 seats, including one sponsored. The course is there in various aims, but the INISS program currently has mentioned only 3 seats. What I've heard is that the AIMS Jodhpur has their own program. They might be conducting their own examinations for the DM infectious diseases program. Again, DM infectious disease program, apart from the AIMS, you have DM infectious diseases program occurring in other institute also, where you can get your admission through the NEET assess. For that, you can have an MD or DNB in medicine, pediatric, respiratory medicine, and tropical medicine is the qualification for that. Now, FNB Infectious Diseases, a fellowship of National Infectious Diseases, has been a course which has been running for a long time. You require an MD or DNB in general medicine or tropical medicine to join it. The entrance examination is a fellowship entrance test FED examination conducted by the NBE, which is going to happen in January 2023. And the FNB is a 2-year course compared to DM, which is a 3-year course. And so this is the seat distribution which is given in the Clinical Infectious Diseases Society website. So there are various hospitals or like medical colleges which has started the DM program. So AIMS, I told you all the AIMS entrance through the INISS, but as of now, though the number is like shown as New Delhi 6, Raipur 1, Jodhpur 4 and all, the current prospectus gives only 3 seats for New Delhi. Maybe rest of the AIMS may conduct another exam, not very sure of that. Again, we have the other institutes like Christian Medical College, Vellore, which has been one of the first institutes to start DM infectious diseases and one of the best institute. Then you have Kasturba Medical College, Manipal, which also has started the course. You have Government Medical College, Kottayam, the School of Tropical Medicine at Kolkata, and other few institute also has been given permission, including IPGMR, Kolkata. So what I want to say is that so these are the institute which conducts the DM program, and then you have the FNB program. The FNB program in some of the institute has been running for a long time. So where like we have stalwarts of infectious diseases or the leaders of infectious diseases as teaching students, which include Apollo Chennai, 4 seats, Apollo Hospital Hyderabad 1 seat, KIMS Health Trivandrum 1 seat, Manipal Hospital Bangalore has 2 seats, PD Hinduja Hospital Research Center 2 seats. The Sterling Hospital Ahmedabad has 1 seat, and the KIMS in Srinagar has 2 seats. And the FNB is, as I told you, is a 2-year program. Now, one question that we always get is the comparison between DM and FNB. Now, as you all know, the DM program in infectious disease is something that is new. AIMS Delhi has started it quite a few years back. CMC Vellore also has started, and these are the two institutes which have established DM infectious diseases program. All the other AIMS as well as the new medical colleges, it is a new program, and we can expect some kind of a teething issues as with any branch. So that may be there. So that is something that we have to be aware of. Okay, that kind of teething issues and starting troubles can be expected when you join for the infectious diseases program. What like whether should you choose FNB infectious diseases? FNB infectious diseases is a good choice if you are doing it in a good hospital. because in some of the hospitals, as you know, the infectious disease program started as an FNB course even much before the DM course was introduced, and they have well established and well structured course taught by eminent teachers, and these are mostly private hospitals which also have good laboratory facilities. So in that way, teaching is excellent in some of these FNB institutes, and FNB definitely can be a choice for pursuing higher studies in infectious diseases. Now, what to look for in each institute, I'll come back. And this is the schedule given by National Board. You can see the fellowship entrance examination incoming in January 2023. The NEET SS and INISS, the INSS is going to come. The NEET SS is already done, but the FET is something coming in January 2023. Now, before you choose a seat, like whether it be FNB or DM infectious diseases, there is something that you have to look at to decide whether a program is good or not. The first thing is how established the program is. So that is something very important, because ID is not just internal medicine plus microbiology. It's a different field of medicine where you should have an established structured program. The well-established structured program, it will be easy for you to join the program and pursue it. And the teachers, again, the question of how good your teachers are, how have they been teaching infectious diseases for a long time? So that is definitely one question that you have to ask for: how good the teachers are, and how qualified they are. In teaching infectious diseases. What about the opinion regarding these teachers from your previous, or those who are passed out, or those who are doing the infectious disease program? One of the main things that you have to look at before the joining an institute for infectious disease DM program is how good the microbiology lab is. The microbiology lab is a very important part of your infectious diseases activities, because unless you have a good lab, you will not be able to work as a good infectious disease physician, because ID physicians requires good microbiology reports, good culture reports like automated culture reports, like nucleic acid or molecular biology labs. Okay, these are something that you should definitely have. Good bacteriology lab with automated culture systems and identification system, and then you should have good mycology. There is fungal cultures and identification system, molecular labs. You can do PCR for various viruses. So a good microbiology lab is definitely something that you have to look up before you choose a seat for DM infectious diseases or FNB infectious diseases. HIV and TB service. Definitely, this is something you will have to treat. Look, what is the HIV treatment? What is how the whether the organization has an HIV treatment services being provided already, because that is definitely mandatory that you have HIV services. TB services, including treatment for MD or TB, whether you have that services in the hospital. Transplant. Again, transplant is very important, because transplant infection is something that you are supposed to address as infectious disease specialist. Whether you have various kind of transplant, including hematopoietic stem cell transplant, kidney transplant, liver transplant, heart transplant, lung transplant, if you have, definitely you will get a good number of transplant infections, and you will be aware of it. And finally, the question that everybody asks us is whether you will get a job after infectious diseases. My answer is definitely yes. There is no such problem of lack of job for infectious diseases. This is an upcoming branch. Hospitals have started recruiting. Most of the large hospitals have started recruiting infectious disease people, because people have now understood the value of infectious disease. Physician, the complex infections, the complexity of the infection that has coming up now has made it mandatory that every hospital, every large hospital at least should have an infectious disease specialist. Larger hospital has started taking infectious diseases specialists, and soon every hospital will be definitely be forced to do that as well. And I feel definitely there is no lack of opportunities. This is from my heart. I can tell you, you will never be jobless. Definitely, you will can get a job, and your job will not be just in corporate hospital. Like, definitely, you can work in hospitals as infectious disease specialist. There are other opportunities as well, as like some of my friends after DM infectious diseases working as public health consultants, antimicrobial assistant consultants with the WHO as well as other international organizations. So there is another branch to which you can move out. Or there are people who are working as transplant infectious disease specialists alone. So there are various opportunities to which you can branch out as well. So once you become an ID specialist, what do you do exactly? It's one question that everybody asks us. So life in the day of an ID physician. So basically, I just wanted to tell you like what I did like last Friday. So my day in the infectious disease department start from the lab. I always go to the lab and I also look at the culture plate. Some of the plates, like the organism may not be finally identified, but you can look at the culture with your microbiologist if it is like if the microbiologist is your friend, and then you can look at the plates and see like maybe guys like this particular organism is this, and you can get some of the cultures from the previous day, and then you go for your rounds. And in the rounds, I get around 20 to 25 consultations per day. Just telling some of the consultations that I saw on last Friday. It includes cases of mucormycosis. There was a case of severe dengue. There was a case of pyrexia of unknown origin, which turned out to be Still's disease. There was a skull-based osteomyelitis in a chronic kidney disease patient, which turned out to be a fungus called Ascidosporium. Okay, this is IP rounds. Okay, this is my own patient. Then I can go for consultation rounds. Now the consult rounds will be your predominant, your bread and butter will be consult rounds. Most of the patients will be sending, like most of your other doctors will be sending consultations to you. So inpatient as such, I don't have like much of infection, like maybe 5 or 6. Most of the other like 20, 25 consultations will come. So the consult that I saw on that day includes severe dengue with HLH, ceftriaxone resistant pneumococcal meningitis, CLABSI, okay, central line associated bloodstream infection with Stenotrophomonas multifida, candidemia, which is fluconazole resistant, bloodstream infection due to another fungi called as Trichospora asahi. Just to say, not bragging, but these are the variety of cases that you get. Okay, if you are somebody who is interested in internal medicine as well as you like the bugs, there is nothing good as a specialty as infectious diseases. Then I finished my like, initial rounds by like afternoon, and I get some infection control issue calls. Now we have like somebody calls and asks me, we have a patient with lupus, plan for microdiscectomy, has herpes zoster. Can he be taken to the theater, or what are the precautions that I should be taking when we are taking them to the theater? So these are the kind of questions that you will get as infection control issues you'll be getting. And then I go to my OPD. Like, so OPD, I'll get a lot of cases of tuberculosis, pulmonary lymph node TB, usual garden variety, drug sensitive TB. Kerala, we don't get too many drug resistant TB, but other hospitals do. HIV, PCP, many HIV patients can come for their follow-up. Some of them may have presenting, like one of my patients is follow-up for PCP. Patients will come for travel advices. One of the students came for advices regarding vaccines. He's going for the UK. Another missionary came to my clinic. He's going to Sudan, and he inquired about vaccines as well as malaria prophylaxis. Another man come with history of unprotected sexual intercourse with a sex worker, and he need post-exposure prophylaxis. So all this kind of mix of variety of cases which you will never get in any other specialty is something that I can guarantee you. So ID is a branch which will never bore you, and there are plenty of opportunities at the current point of time, and which will not be, I feel, which will stay the same for at least a decade or so. So that is it regarding infectious diseases, the scope and future. If anybody of you have any doubt, you can post your doubts here. Any questions, anybody? I'm not seeing any questions in the chat box. If anybody has any doubts regarding the courses that you want to take, I'm not going to specifically talk about the institutes, but regarding DM and FNB in general, I'll be able to help you. Definitely, so I don't think there is any question. I hope I have explained and at least inspired at least few of you to take infectious diseases. Thank you. I think we can end it now.